we would like to welcome Dr. Suhas. Dr. Suhas is currently working at the emergency center at the Mazumdar Shaw Medical Center, Bangalore. Dr. Shah did his MBBS from the Srinivasan Institute of Medical Sciences and Research, Bangalore. Post this, he has worked as a casualty doctor at the Yannapoya Specialty Hospital, Bangalore, where he also assisted some neurosurgeries. He is currently also pursuing his postdoc in emergency medicine in Bangalore. Dr. Suhas, we welcome you on board.
Thank you so much. Thank you guys for having me.
So, just a few general questions about COVID and how it, affects the various aspects of our lives these days. So every day we hear these updates about this vaccine is coming out, this clinical trial is in the human trial phase. This is happening here. Russia is claiming that its first human trials got successful. So, and honestly, it's all stuck at home and just desperately waiting for a vaccine to come out. So, when do you think that's going to happen?
Actually, the vaccine in India has come up now. As you might have heard in the news yesterday and day before, from the day we are talking today, AIMS has started human trials. This human trials of vaccine, they have issued some specific guidelines. They are taking a specific age group of people around 18 to 55 years old without any comorbidities. That means without any diabetes, hypertension, or any other immunocompromising disorders. So these people, they have put off a link and a phone number they have given up where they can enroll themselves. So only 100 are being taken right now, which is, I guess, right now by already full right now. Those people will be first screened for COVID, whether they have COVID or not. Later on, they will be put on through a fitness testing, and then they will be undergoing the vaccine trials. So it will be a bit more time before we know how much efficient it is and more results on people. And 100 is a very less sample size to comment on it. So in India, I think it will take another 1 or 2 months to have a more clear idea about it. Whereas Russia on the other side has confirmed that it's safe and it gives immunity around 3 to 4 days ago. Yeah.
Okay, that would actually be great. So as the rainy season is also around and it's beautiful outside though, but it also comes with cold, cough. So, and given the scenario these days, the moment you get khansi zukam, the first thought that comes is, kya mujhe COVID to nahi ho gaya? So how do you think we can, how can one differentiate, kya mujhe COVID ho gaya ya kya mujhe khansi zukam bukhar hai?
That is the most important question in this talk, if you would tell me. Because right now, the trending topic around the world is COVID. And we'll have to know what are the symptoms that it comes up with, which can be other things. So all these cold, cough and fever comes under a broad category called ILI, influenza-like illness, which imitates COVID. But there is a stigma around COVID that it is spreading fast, but people need to also know that it is not killing as fast. The mortality rate, the number of people dying from COVID is very less. So people have to not be that afraid and take COVID as an illness, but also not neglect it and get treated. So the moment you have a fever, cough, cold, definitely it can be COVID. I'm not saying no, definitely it can be COVID. But at the end of the day, you have fever, cough and cold. You do not have severe breathing difficulty or inability to walk, eat. Nothing serious has happened to you. So the moment you have a symptom, you go for help, get help, meet a physician, meet a pulmonologist. If they advise you to go ahead for a testing for COVID, please do it. If not, there are medications to treat your symptoms that can be done. Isolate yourself, get good rest, eat good food, have adequate vitamins, and that should do it. And as and when you have a new symptom, you can go for a further follow-up again and again. Suppose you have cold and cough today, you have started on some medications. 3 days later, you start having breathing difficulty. So everything you have to update your physician or the pulmonologist and then follow. So that way you are not neglecting something called as a cough and cold, or you are overestimating the severity and being tensed or afraid of it. So that should do it.
Okay. And what would you say in terms of there is a good population in India which is now being tested as asymptomatic? So, and not just asymptomatic, also the aspect that, because asymptomatic, you're not getting hospitalized because most hospitals are not admitting you at the moment. So how does your family dynamics work at the moment? कि क्या मुझे अपनी फैमिली मेंबर के साथ रहना चाहिए अगर वो एसिम्प्टोमेटिक है, क्या हमें उसे आइसोलेट कर देना चाहिए, कैसे करना चाहिए?
Okay, so when this COVID thing came to India, before it came to India, if you would say, it started in China and there was huge news all over the world. This is something that is going to spread. This is something that is affecting people very fast. Then most of the Indians did not believe it would come to India. They were in like denial and then they were in anger when it actually came to India. Then there was that bargain, it might not be COVID, it might be COVID. And now people are depressed and finally we have to reach the stage of acceptance that we have gotten COVID and it is there and it is for us to deal with right now. And the thing about asymptomatic patients, it is because of all this fear that was created before COVID actually came here. People started getting afraid the moment someone in a road, 2 crosses next to your house, a block away, a city away got COVID. It's like, oh yeah, next step is coming, the doom is here. The view was like that. But right now, there are different examples and there have been proofs for people who are asymptomatic, for people who are very young and fit and healthy. The cure rate is very good. There are only few people that die of it. And about asymptomatic patients, you can never know. If the patient is asymptomatic, you can never know he has COVID. But somehow he gets to know on a regular testing, or he himself volunteers for a testing because he thought he might have come in contact with a COVID patient or things like that. In that case, he's completely fit, he's completely comfortable, he does not have any cough, fever or anything, but he comes as COVID positive. In such cases, yes, isolation is definitely required. He cannot continue to stay with his family members. The least he or she can do is to stay in a room separately, isolate themselves for up to 2 weeks, which is bare minimum. Watch for any symptoms if they have a cough, fever, cold or anything. And it is better to monitor their oxygen saturation. How much the percentage of oxygen in the body. That is one thing that is bare minimum that can be done. And if any symptoms develop, to consult a physician. If not, a week or two later, they can go in for a repeat testing as advised by the physician. If they turn out negative, that should be fine. These people usually fall under category 0 or category 1 of COVID, which have good cure rates, which do not go into any severe forms of disease.
Okay. So when you mentioned a lot of things about asymptomatic patients there. So what I would like to personally kind of know is also, say you don't think so you've gotten in contact with a COVID patient. So like, if you could give us some demarcations, some like I wouldn't say symptoms, but I could say maybe your hunger drops or you have sudden changes in the mood or something like that. Is any of that associated, or any studies that have come across as of now?
Okay, that's a good question. By the way, the thing right now here is there is no specific demarcation between COVID and an influenza-like illness, like I told you about, like a common flu, like a common cold, what we call it. So since there is no demarcation, what it also helps us to understand here is, even if you demarcate and if you find out it's COVID and you're supposedly doing it on symptoms like loss of appetite or loss of sense of smell, anosmia as we call it, these are at the end of the day simple symptoms. They are not life-threatening. So even if you identify COVID, even if there were specific reasons to identify COVID, it just gives you a mental stress that it is COVID. You are not suffering physically. So the stigma around COVID being an illness that is killing everyone should go. It is something that is spreading really fast. It is something that can definitely kill, but it's something that can be cured better. The cure rate is too much. Okay, so what we can do here is, instead of demarcating by symptoms, you take care of yourself by 3 simple steps. The 3 simple steps would be just wearing a mask, following good hand hygiene, hand washing every now and then, and also social distancing. If you take care of these 3 simple steps, there is a very less chance you might not get COVID. And even with this, if you get any symptoms, it is never 100% sure that you can, differentiate COVID just by symptoms. In that case, if you feel difficulty, discomfort enough, go to a physician, and only a RT-PCR testing, which is of high sensitivity, is a good method to differentiate COVID from anything else. And whether it warrants medication, does not warrant medication, whether it warrants COVID testing, all these decisions will be taken by your physician. So there is no specific symptom that will differentiate COVID from anything else. But any symptom, if you feel discomfort enough, you have to go and get it tested. That would be the advice.
Okay. So just one last follow-up question on this would be, when you mentioned the RT-PCR test, the RT-PCR test was there ever since, say, they started detecting COVID. That was one of the most founding steps. But then there are other steps, there are other tests now. Say, for example, the paper strip test that has come out from, I think it was IIT or IGIB. Or there are other commercial tests as well that are now available that I come across. So what would you suggest? Like, should one just take an at-home test as well?
See, at-home test is a term referred to a lot of things. Sometimes there are laboratories that give provisions to come and take a sample from your home, and you don't know what kind of testing they subjected to. What we do, standardized testing here, is an RT-PCR testing. That is of more sensitivity, and also if you're suspecting COVID strongly in a patient, it is better to go for an RT-PCR testing. Because we see on a daily basis here, we have something called as an RT-PCR test is one. Another, we have a CB-NAT testing. Another, we have a TrueNAT testing. These are all different methods. I would not go in detail. But a CB-NAT testing in our hospital would give around report within 2 to 3 hours. A TrueNAT testing would give report around 6 hours. Whereas an RT-PCR would take up to 12 to 18 hours. So sometimes you are forced to go for a TrueNAT and CB-NAT. Suppose a patient has come with a breathing difficulty, with something else. He needs an emergency surgery. You're not willing, you're weighing risks versus benefits to put him in a room full of surgeons, anesthetists, and other nurses. So you go for a test which gives reports faster, like a TrueNAT or a CB-NAT. But the problem here is the sensitivity is not that good. Suppose there are 100 positive cases. A CB-NAT or a TrueNAT would identify 60 positive cases correctly. Another 40 it would give negative. But they are in actual positive. But an RT-PCR would give around 90 to 95 patients correctly as positive. Another 5 it might miss. Okay, this is a sensitivity of the testing. So you have to weigh risk versus benefits while subjecting someone to a test. If someone who is a 25-year-old male is fully fit and fine, he goes out, he has met a lot of people, probably he works in a factory, and he comes back 2 days later, he has severe breathing difficulty, he's coughing like anything, he has a lot of sputum. This is a guy who you are suspecting COVID strongly in. In this patient, it is not so useful to subject them for a TrueNAT or a CB-NAT and risk getting the test result as negative. It is better you put him on an RT-PCR test, which has high sensitivity, so chances of you getting a positive test in a highly suspected case is good. In other reasons, like someone who is very young, who is very fit, who is a school-going children or school-going students, basically 16 to 18 years of age, they are in home isolation because now schools are closed, and suddenly they have severe abdomen pain. And once we do a scan, we get to know it appendicitis with the appendix burst. He needs an emergency surgery. So you're not suspecting COVID in such a patient. He has not had any exposure, no travel. In such cases, you can weigh risk versus benefits, go for a CB-NAT or a TrueNAT testing, get the report within 2 hours, use that 2 hours to stabilize the patient and take him up for surgery. So these are the calls that the physician will usually take based on your symptoms and the background, the contact, the travel history, the other things. Yeah.
Okay. Thank you so much for that in detail explanation. So now coming on to you, as you are a doctor, this might be a very challenging time, not just for you, but for your family as well, because you are on the front line and you are actually dealing with COVID patients every day. So what is your mindset, and how afraid is your family, and how do you cope up with all of that?
Yeah, that is a good question. The thing is, we started approaching it like any other humans do, leaving the doctor thing apart. When we saw the news first about the virus in China that is spreading fast and other things, we were also in denial, anger, bargain, and depression, acceptance, all those stages. So once the cases started coming into India, we started expecting India will not get, Karnataka will not get, the hospital I'm getting will not get. And even it went into stages where we work in shifts. I'm an emergency physician. I'm in a morning shift today. Morning shift I'll not get. Night there might be some case. Eventually in morning shift, okay, there are 3 doctors, I will not get. Maybe the probably other 2 doctors will see the case. This is how much you deny that you will actually come in contact with someone. But then it is how fast you reach acceptance and agree what is happening and plan something to deal with it that changes everything. So my parents were also obviously scared and tense, and they did not think of it as something that you should stop working and come back home, and because that is definitely not the solution. This is a need of the hour that it should be treated. So when I got my first case, the hospital received the first case. We treated him. He got cured in 4 to 5 days, as if I remember properly. But when the first case came, we received him, we put him in an isolation room, we started treating him in the ICU, and then we sanitized the whole area. The whole area was clean, every measure was taken properly. But then slowly we came to a point where in which every other case, every person coming with a breathing difficulty, every person coming with a fever was COVID. We were not able to get every patient to an isolation room. We were not able to clean the area, fumigate the area after receiving every patient. So we are in that stage now. So initially, I think that was one thing about being scared of COVID that forced every hospital in India to admit every patient who is COVID positive. Although he was comfortable, although he was not in too much discomfort, I would say. But right now, I think we are slowly realizing if they are not symptomatic, if they have minimal difficulty like cough, fever, and cold without breathing difficulty, they can be treated at home. So we are giving them good treatment options. Such people can be isolated and treated at home. So hospitals can have more beds. So with all of these things, with more and more time, we are streamlining everything. So hence us dealing with our families, coming back home, isolation, social distancing, all that is also settling well. Although most of us haven't met our family members in 3 to 4 months, but anyway, since we are doctors, we are working in different places. Not many of us stay with family members to start with. So that also helps us from preventing giving the disease to our own family members. So yeah, we have regular conversations, update them on what's happening. The tension is there, but since everything is getting streamlined, I think we will only go upwards and onwards from here. So it's going to get better.
Okay. So as you mentioned sanitizing, you are doctors, so you have to wear PP from head to toe, like for the entire duration of your shift. How do you cope up with it? Because honestly, wearing a mask for a given amount of time whenever we are doing it, though it's not that difficult to breathe in it, but there's that stigma that I have this, a layer of cloth or whatever membrane on my nose and my face, so it's making me difficult breathing. So how do you cope up with all of that?
It was really difficult for us to start with, actually. The hospital that I work in is a private setup. It's a centralized AC setup. So the moment this COVID came, which is airborne, which spreads through aerosols, the whole centralized AC concept went off. The AC was shut down. There was room for more ventilation, and hence it was hotter with the PPEs on. What we wear is an N95 mask, the mask that we wear, and it tends to retain the carbon dioxide you exhale. So you inhale oxygen, you exhale carbon dioxide in general terms, if you have to say it. So the more and more carbon dioxide you exhale, it does not go out into the free air because of the mask you're wearing, which is most times tight. So you tend to inhale more and more carbon dioxide, and you reach a point where you retain CO2 more than what is required. So that retained CO2 can cause you headache, lightheadedness. These things will be the most difficult to deal with. The sweating, feeling hot things comes later. And usually in the first 1 or 2 days, we felt really difficult to deal with it. We were doing 6-hour shifts, 7-hour shifts. Slowly the cases started increasing. We were forced to do 8 to 12-hour shifts. And now most of our colleagues are infected with the virus. They are COVID positive, so they are under treatment. So whoever is COVID negative are doing extra shifts to compensate. And it's getting more and more difficult. But then it is like when the virus came, we started doing things to adjust ourselves to somehow deal with it. So every day we find something more better to deal with it. And there is no second solution to retaining CO2 or sweating inside the PP, but it's the need of the hour. And basically when the emergency is busy, when we have a lot of patients, we really don't have time to think about it. So only when the shift is done, we will know how tired we were, how much we need some water, some sleep, or just use the washroom in most cases. So it's difficult, but I hope it settles well. I hope my colleagues come back from being positive to negative, so we have more and more power. And more doctors who have just finished in the recent batch that finished, if they all plan to take up COVID duties for the next 1 or 2 years, it will be really helpful for the existing field already.
Yeah, that would actually be, and hats off to all the doctors doing this every day. So some other general aspects would be there are some people, say elderly people or with already people who already have illnesses. What do you suggest to them? They have to go for regular checkups in an ideal scenario. It's like every month or every 3 months or every 6 months. But now, given COVID, they're in a situation where they're in a dilemma. Should I go to the doctor? Should I not go to the doctor? What do you suggest in that case?
Yes. That is a very good doubt the people with already existing comorbidities have, because they have some problem for which they need a treatment, for which they're used to visiting hospitals regularly, but now there is something of a risk of going to the hospital itself because of the existing COVID spread. So what I would suggest these people is, if your problem, existing illness, is not giving you too much discomfort, all you're requiring is a regular checkup, 1 monthly, 2 monthly, 3 monthly, then you can avoid going to the hospital. So many hospitals have set up video conferences, online consultations is what we call it. You can try approaching such hospitals through video consultations, so your risk of acquiring the disease will be less. And it also serves the purpose that if COVID happens to a person with already existing comorbidities, it can be a little serious than a person who is 20, 30 years old. So this also helps if you go for a video consultation, but you always have to weigh the risk versus benefit. You cannot have a severe kidney problem where you need dialysis every 3 days and wait at home for 1 week and do dialysis only once in a week. These are risks that you are not supposed to take. Such patients do not have any other option. But there are hospitals which are managing with good social distancing, hand wash techniques, good sanitization. They're giving different allocated slots for different patients in OPD based on prior appointments or token systems. All of this is on the internet. You can take 1 hour, 2 hour and do some research on this and find the hospital that gives you all these privileges and you can go for it. One more thing would be, if you already have medications that you're taking regularly and in your every 1 monthly, 2 monthly checkup, not much is changed, you are comfortable and you're going ahead, then definitely you can leave the idea of going to the hospital and try a video consultation or a video conference. If none of this is available and if you are in severe discomfort, please go to the hospital. Do not risk something happening to you because of already existing problem in the fear of getting COVID.
And say, for example, what would you suggest? Because a lot of doctors have their own private setups as well. So would you suggest somebody, because people have this notion, oh, if I go to the clinic, it's less people, I'm not going to get COVID, and all of that thought process comes to a general person's mind. So would you suggest that one should go to the clinic as opposed to the hospital if the doctor provided, is practicing at the moment, which I'm not sure. But then say, you never know in the future.
Okay. It actually depends from place to place. Some clinics do not have more patients. I agree. Some people have a lot of patients. Some senior clinicians, consultants are very famous. They have always had more patients every day, from 100, 200 patients every day. So you can decide based on what you're looking at, from where you are going to get consultation done. If you're going to a hospital which is a tertiary setup with all facilities, mostly all the hospitals will take care about hand sanitization, masks, social distancing, everything will be well managed. But if you go to a clinic which is run by one consultant, probably he will not be able to make sure everything properly. But again, this is just a generalized idea. There are both kinds of things. There are hospitals which are crowded. There are clinicians who are doing alone but maintaining social distancing. It is not difficult for you to find out if you just take a look at it on their advertising pages or social media, or you have seen it yourself with your own eyes. The social distancing, the mask, sanitization methods, if all these are taken care of properly, it does not make a major difference whether you're going to the hospital or the clinic, because you can come in contact with a COVID patient anywhere because it is so widespread. It is not a general idea that clinics will not have COVID and hospitals will. It is just about how good that setup is taking care of the situation.
Okay. Coming to another very important aspect of COVID in India, we are a very social country. So our society is built in a way that if one person has a problem, the other one just has to rush. It's like an immediate given. So what would you suggest in those cases? Because, say for example, my relative gets COVID positive. He's in the hospital or he's in his isolation. But should I go and visit his family or should I not? Because you're having this thing that, oh, I need to be there for the emotional support or whatever.
This question applies to the same as asymptomatic patient dealing with his family members. When you're asymptomatic or when you're COVID positive, imagine being in a different home or in a different room in the same home altogether. So the question of meeting family members who are COVID positive, who are probably having some other illness or who are suffering from anything physical or mental, it's just ruled out basically in this situation here. And most of the states and cities, districts are following lockdown rules. Minimal travel only when it is necessary. So the whole idea of social meetings is ruled out. Even the marriages are cancelled in most cities. So the only way you can communicate with them is through phone calls, video calls. I would strongly suggest not to go out and travel to meet your relatives or anybody else that you know in this time, because it is not advisable. Again, weighing risk versus benefit, you can meet them anytime, you can talk to them over the phones, but risking getting COVID and coming back home and affecting other people, it is not a good idea. So if in case your relative is affected, give them enough emotional, moral support through phone calls. You can keep a check on them. Make sure they're getting the right treatment. If you have to suggest any doctors, hospital to them, you can do these things instead of meeting them in actual, because actually that is more helpful for them right now, because when they're isolated, once they're COVID positive, the things that they would start to miss is human contact or human interaction. So you can keep in touch with them through phone calls, video calls, and that should help them, once they're out of it, probably once all these things settle down, you can meet everyone that you know.
And what about I'd say the psychological effect, not just on people who are stuck at home, but even the doctors. You guys have, as you mentioned, crazy long shifts in all of that PP, sweating crazily. So what happens there?
The only thing that we think about when we are in a long shift, if we get time to think about it, is when will this get done? Just like everyone on the outside is waiting for a vaccine, we are waiting for that shift to get over. And mostly when that happens, we will have that thought for a minute or probably 2 minutes before we get another serious patient who comes in and we'll have to deal with something. And I feel personally the worst part that I had to face because of COVID is telling a patient or telling a family member that we are almost full. We do not have beds. I think so many people or doctors or hospitals in India is facing this problem where they are running out of beds. Because in a country like India where the population is so much, of course you cannot have 100 crore plus hospital beds for everyone. So what we try to do is treat asymptomatic patients, treat stable patients on OPD basis, follow up on them through video consultation, make sure they're doing all right, and try and arrange a bed for them as and when needed. So since it is a disease that is spreading so fast and so many people are getting affected, most of the times we are full. So when we are so full, we usually don't get time to think about it, to deal with it, how the emotional aspect is it. Because even when we come back, all I can remember is have some food and sleep off, and when you wake up, you're in time for the next shift. So you work and you sleep. It is going like that now. I hope it settles down there.
Okay. This was a great talk. Thank you for telling us so many things about COVID and its various aspects, and thank you for taking the time.
Thank you so much. You guys are doing a great job. You guys are doing what is required at the time of the pandemic. Like I told you before, the best way to deal with the disease is understanding it completely. And you are doing more than what you can right now to let the public know what the disease is, how to deal with it, how to use simple steps to prevent it. This information is invaluable at this time, since most of the doctors are in treating patients and not getting time of it. This interaction, I hope it helps a lots of people. For that they should probably follow your channel more. Yeah.
Thank you.
Yes. Thank you so much.